Welcome to the Soul of Medicine. Welcome to our Soul of Medicine podcast. We're so happy to have our guest today, Dr. Valerie Warren. Hi, Valerie. Dr.
Hey,
Warren.
guys.
Good to have you on.
Thanks so much.
Yeah, totally. So thank you so much for agreeing to be on and talking about this awesome topic of holistic dentistry, functional dentistry. I know a lot of our patients have questions about your specialty, and it's so needed. So I'm going to go ahead and introduce you. Rob, did you want to say something?
No, I'm just excited as we go along here.
Okay. So in this episode, we welcome Dr. Valerie Warren. She is a pioneering functional and holistic biological dentist from Owensboro, Kentucky. Dr. Warren sheds light on the often overlooked connection between oral health and overall well-being, challenging conventional wisdom and sharing insights from her integrative practice. Welcome, Dr. Warren.
Hey, guys. Thank you so much for having me. I'm excited to be here and have this conversation, and just grateful for you both.
So can you tell us a little bit about your background and how you became interested in holistic functional dentistry?
Sure. So I've been practicing dentistry for 23 years. Born and raised here in Owensboro, Kentucky. Not always holistically, so practiced the first 13 years just very traditionally. And it was really a shift in my family's, my own personal and my family's health that kind of initiated my shift into holistic care. So huge personal struggle, but that really enlightened me with regards to health and nutrition. And so just piece by piece integrated that into the practice as well.
Awesome. So for listeners who may not be familiar, could you explain what functional holistic dentistry is? Holistic biological, it has all these terms, right?
Sure,
So
right.
maybe you can define all of those things for us.
Yeah, so functional dentistry is more of like an umbrella term, I would say, that just includes a more like whole body approach to dentistry, considering, the impact of oral health and things that are going on in the mouth with the rest of the body, which is the way it should be. So our practice philosophy takes on a little more holistic approach to that as well, as far as utilizing non-toxic materials and kind of focusing a little more holistically. So basically driven in root cause approach, not just treating, the problems, but trying to address the why and then prevention. Like how do we prevent this from happening in the first place? So one of the biggest drivers for me is that my goal, I became so much more knowledgeable in the role of nutrition in my family, like through that health struggle, that it really shifted my conversation with my patients. So for like the first 13 years of practice, it's somewhat frustrating because people are like, I don't understand. I'm brushing and flossing because that's what we're taught is like the main thing. And I didn't really have answers for them. So when I started understanding the connection between gut and diet and, nutrients and minerals and sleep and all of those things, like it gives you a more depth. It's a little deeper. So it's a more like whole body approach, a little more like organic approach as far as materials. And then just collaboration with practitioners, like very intimately like you guys, as far as working towards eliminating, looking at the mouth and the things that are going on in the mouth in relationship to body, mind, spiritual wellness.
I first came across that connection by reading the book Cure Tooth Decay by Ramil Nagel. Have you heard of him? And I believe he was doing some research with the Nourishing Traditions guy,
Weston A. Price and Stephen
Yes,
Lin.
yes,
Yeah.
Weston Price. So that was huge in my practice when I was in Pennsylvania, and we had anthroposophical view of the, integrative practice. And a lot of our patients knew of Weston Price. It was really huge around that area. This is where I learned how to cook broth and do all those really cool things. So, and I actually met him at a conference for meal. And that was just really, it blew my mind, in fact, with the health of the gut and this relationship, because I would get a lot of kids in the practice and didn't know what to do and didn't want all of those interventions, but didn't really realize that the gut and nutrition and absorption and all of that was really important. And there was that connection. And maybe you already know this, but wasn't there that landmark study when Weston Price went to Africa and was looking at the teeth of, I can't remember where he went. I don't know if it was the Kenyans or somewhere. Maybe you can enlighten us on that.
Yeah. So he's a huge, foundational, his studies are critical to my practice philosophy. So he studied ancestral skulls. In those studies, our ancestors had these big, wide smiles, like plenty of room for their wisdom teeth. And they didn't have cavities. So that translates into a lack of airway issues, a lack of sleep apnea, and why didn't they have cavities? And so his research really supported the fact that diet and our shift in processed foods, the lack of nursing for a long time, the lack of chewing foods from an early age, those types of things are really much more impactful than the type of toothpaste you're using or your brushing and flossing technique. So we love his research. Stephen Lynn is a dentist that wrote a book called The Dental Diet that's kind of based off of those same principles of Weston A. Price. But yeah, I mean, it's a cool study for sure.
So I know too, there was a chiropractor, Dr. Gillespie in Pennsylvania. Also, he was a dentist. I don't know if you know him, but he would teach a lot of the myofascial release and the craniosacral therapy. And he would go to these on mission to help widen the palate it was a latch initiative for babies who couldn't latch. But that also brought me to this, some maybe the birth traumas and even just the way that the jaws were being formed. And that was leading to a lot of it too. And the need now for the orthodontics in kids, is that even related to health and wellness? Do you know what I mean? Is that part of the problem?
Yeah, we really seek for an early intervention. We work a lot with what are called myofunctional therapists now. I don't know if you've heard of that, but they're kind of like physical therapists for the mouth. And so we have referrals that we use for that actually evaluate ties. From infants on. And I'm doing a lot of this with adults as well, because the studies show that if you correct those underlying fascial issues, that orthodontic intervention isn't either needed or nearly as complicated. And the other thing is that relapse. So if you correct those underlying root causes of ties or tongue posture or dysfunctional tongue patterns, tongue thrusting, swallowing patterns, like how you use your tongue, then orthodontic relapse and like wearing your retainers or having bonded metal bars isn't necessary because the misalignment isn't going to go back because you're addressing root cause. So then the misalignment isn't going to revert. So we're really excited about that. That's something that really has evolved, I would say, probably in like the past 5 years. So I learned nothing about ties, fascia, anything in dental school. But we work very intimately with a group out of Evansville. There's a group in Nashville. There's some in Louisville that we work together. So we always recommend, and I would say for everybody, like we recommend a myofunctional consult in collaboration with an orthodontic consult to address those issues, always seeking an airway focused orthodontist. Because when I had orthodontics, my orthodontist pulled 4 of my permanent teeth. So you address crowding by removing teeth. And that makes me really sad now because I wish I had those teeth, because your arches kind of collapse, which leads to balance and structure dysfunction and wrinkles and that lack of facial support in certain areas. And then airway support too. So we really seek airway-centered orthodontists and collaborative efforts with myofunctional therapists to address those issues. It's really cool.
You can see like so brilliant.
Yeah.
Wow. We send our people to, myofascial release therapists.
Yeah.
And now I can see that's really brilliant. That's interesting. And so would that prevent, say you did have orthodontics as a kid? I did. I had my wisdom teeth pulled, same thing. And then I notice now that my lower teeth are crowded. So is that a function of, okay. That also is related to wrinkles? What the heck? How do we get our wisdom?
That's just kind of natural because in my own arch, I'm like, my lower arch, my back teeth have kind of, and I'm doing some Invisalign to correct that, but I can't unless I massively go under massive orthodontics and have 4 implants placed, I'm not going to regain the 4 teeth that were removed. So I have to think as, the lower third of the face being that's the area that we age the most. And so as a woman who's obviously, aware and conscious about, I don't really want to do the typical traditional things that people are doing for, preventing wrinkles and all that, but your mouth and your teeth support has so much to do with how you age. So if you look at we call your vertical dimension, which is your space between the tip of your nose and your chin, as that decreases, whether that be from clenching and grinding, and so even 2 to 3 millimeters of tooth loss, or orthodontic shifting, misalignment and symmetry, your wrinkles or your facial shape and all that is going to be impacted. So, so that's just another kind of aside, but yeah.
That's really interesting.
That's fascinating. I got to ask, a lot of times when people have dental surgery done, right? It's a structural thing going on. So, could even the small nuances of movement lead to an issue further on in the body where a myofunctional therapist would actually provide some benefits there?
Yeah. I'm just a deep thinker. So I also think a lot about chiropractic alignment, and muscle tension, and your mouth and your, the plane of your teeth just being an extension of that. And it comes into play too when you're having dentistry done. So if you have a crown placed at one time and then another crown placed, so minor, discrepancies in how that's done in regards to your bite. So if it's just a little too tall, or, if it shifts your balance, then it has to impact muscle tension, fascia tension, your spinal alignment, all that as well.
A complete trickle-down effect. Yeah.
Yeah.
I had read that somewhere that young girls, particularly when they have, or that could it lead to the scoliosis, or an accentuation of scoliosis, or some spinal?
I would have to, I don't know these specific studies on that, but I would have to think that it has not, definitely.
That's so interesting. Mm-hmm. Wow. Because it's all related, right? The fascia system is from head to toe, particularly from the roof of the mouth to the plantar fascia. So that definitely makes sense. Dang.
Right. It's cool stuff. And even tongue posture with Stephen Lynn does a lot of posts and information about vagal nerve and tongue posture and breathing and how that all, you may know more about that than me, but how that all impacts overall health as well. Just as far as fight or flight and being able to to all that too. So it's important stuff.
I think that's so brilliant. Okay. So Rob, did you have another question?
Not so much a question, but what I'm hearing is this true relationship between the mouth and the feet. I'm hearing mouth size openness. I start thinking of the feet and the ability to spread. The environments that we do for our feet and for our mouth are very similar.
Well, now that you're saying that, in that study that Weston Price did, in those tribes, they weren't wearing shoes. And that was that sort of relationship that we see in foot care and foot health, to go more on that barefoot situation. And they were doing or studying some cultures that are normally barefoot. Why would you put your foot in a shoe, and that relationship to the mouth? Okay, this is so fascinating. I love all of this.
Okay, so I feel totally vindicated here because I will go barefoot anytime. Sometimes when Kay doesn't want me to, but my teeth were pretty good.
Yeah, you never had braces, dude. I was wearing like
I still got my wisdom teeth, everything.
Shoot. I'm wearing 4
No cavities.
stilettos. I had braces for 5 years. I love how you talk about diet with your patients and stress and all of that and the environment. And so do you talk to them initially when there's or when the problem comes up, or is it part of your intake when they come into your practice, or if you see something going on with them? How does that work?
It's a real personal passion. So diet and nutrition is a personal passion of mine. And I think we'll go into that a little bit later. But yeah, our new patient exams are scheduled for at least 2 hours. And we go into, that's a huge part of our conversation. I like to know like what you're eating on a daily basis, what you're drinking on a daily basis. And it's not just what you're drinking. What you drink is a huge part of it as far as oral health. And it's not just what you're drinking, but how you're drinking it. So the trend today, with Starbucks drinks and even kombucha, those things, if you're sipping on them all day long, your teeth are being repetitively exposed to sugar and acid. And so and it's always even, I'm really thankful and grateful. I have a really cool demographic of patients. We have great conversations and they're just my people, but it's just, there's so much enlightenment and education to be made about diet. And so we have so much conversation about that and the hidden sources of sugar and even things that people don't realize as far as things that can impact the teeth. So even like organic, all natural, but like bars that are going to break down into, sugars in the teeth. Some of those can result in cavities. So we have a very extensive conversation about diet. Things that people don't think about that are high contributors to cavities are like saltine crackers. Goldfish crackers are a huge issue for kiddos because they're easy, but they break down into sugar. And so we talk a lot about that. And then, really, again, Weston A. Price, Nourishing Traditions focus, but all the things that you can add in to your diet to help strengthen the teeth and then gut, it's vice versa, but gut as well. So it's really critical because, again, my goal and my passion is to educate and empower my patients to shift generational tendencies. So I look at my own kids who had cavities growing up. I just didn't have the education that I have now, and I just didn't have the knowledge. And so my goal is to help other parents and people to shift their trajectory from a dental perspective, but also whole health perspective. So if I can help them, because the real goal is no dentistry is the best dentistry. So once you have a filling on a tooth, even if it's small, it's going to have to be maintained. Usually within 10, 12 years, at least you're going to have another filling. And every time you do that, it gets larger because, I have to take that filling out, replace it. And so teeth aren't that big. So so if you start having fillings on permanent teeth at a young age, it just sets this dental trajectory of what your path for your future is going to be. And so prevention is key, but yes, diet is probably, in my opinion, the biggest thing that we can educate and empower people on. So it comes with some resistance, as I'm sure you guys know, because I know as being part of your practice, it's a big deal. And so I try, luckily, a lot of people in my practice witnessed my own personal journey, but it comes with this stigma of, I just can see it in people's eyes. And I was there at one point, I'm just really not sure I can do that for my family. I'm just really not sure I can make that. It seems a lot harder than it really is. So luckily from personal experience, I'm able to say hey, it can be really simple. You can eat meat and a sweet potato or broccoli, it's really not that hard, even if you're feeding a family of 5 or 6 or, so we talk through those things and give suggestions. And that's probably the thing that kind of lights me up the most, really, is because that's really going to make the biggest shift dental wise.
That's so true. It is hard. And like you said, we're shifting thought processes and just things normally. And you're saying more about preventative medicine or dentistry here. And, to me, it's just like, hey, if you don't want those teeth taken out, if you don't want the fillings in, hopefully that would be enough. But it takes a bit, and you as the pioneer in this and with all this information, sometimes somebody has to be in the front leading that, and that's great who you are. So you mentioned something about fillings. Could you, and this is a huge topic in our practice as well, about amalgams and removing them and safely doing them. Could you talk about your stance on the fillings and how do you address those patient concerns?
Yeah, it's a huge part of our practice. So we're certified in what's called the SMART protocol through an organization called the IOMT. And it's just a set standard of protocols, equipment, methods that we use to protect both our staff and patients. So just to go in a little brief history in regards to the history of amalgam fillings, and they've been used for a long time. They're still legal here, but the FDA did finally release a warning statement against mercury fillings in September of 2020. So to kind of back up from that, it's kind of ironic. So in 2017, and we've never used mercury in my practice for 23 years, but a lot of people still do or did. So in 2017, we were required, all dental practices were required to install or have installed by a certain date an amalgam separator. So like from a government perspective, they recognize that it's toxic. Like I can't put it in the water system. I can't go dump it in the pond behind my office. But when I would send my assistants off to be trained for expanded duties, they were still teaching like a full day of mercury amalgam placement. So I would, call and be like, I don't want my assistant learning this. We're not going to use it. Like, so it's just like very doesn't make sense. Right. Like, so if you can't if I have to have a separate separator, like because it's a toxic substance, then it shouldn't be put in people's mouths. So you can research too, like Dr. Hal Huggins was actually at the University of Kentucky, like 50 years ago. He did a ton of research in regards to mercury fillings and the association with a lot of neurological issues, and went to the ADA and the FDA and all that. And really, never got the recognition that he deserved for all that. But it is kind of coming to fruition now. So I think it's been banned like by 2026, I think. I don't know exactly, but in Europe, it's going to be totally banned. So hopefully we're moving into that direction. Basically, the science is every time you chew or have temperature change in your mouth, so you eat or drink hot or cold substances, those mercury fillings, which are the same component that like the mercury in the thermometers that we used to all, be so scared of in school, it's poisonous. So those mercury fillings, every time you chew or have temperature change, are releasing mercury vapor in your mouth, which you inhale and crosses the blood-brain barrier and has, definite association with neurological issues. So our protocol consists of, giving you activated charcoal in our practice. We have special equipment, like not only the regular suction, but a different kind of suction. We cover the patient head to toe and administer oxygen. And we use isolating materials like what's called a rubber dam and covering the head and the hair. And then we section, instead of using the dental handpiece to kind of burn out and create vapor, we section it in a way that produces the least amount of vapor to remove it. So, and in doing that, when we treatment plan that, my conversation is always, hey, do you have a functional provider? And if not, we make recommendations for that with people like you guys or wherever the patient's from, that they connect with somebody in regards to if their provider recommends anything additional. So according to like the IOMT, there's another organization called the IBDM that has a similar set of protocols. You don't have to do anything additionally, but we kind of treat it on an individual basis. And so if we encourage them to get established with a functional provider and to determine if there are additional things like liposomal glutathione, liposomal vitamin C. A lot of these patients are already doing those things, but if there are things to work with their specific providers on to best prepare them for the mercury removal process.
What I found was I don't know if you remember this, Val. It must have been 10 years ago. I was looking at like the IOMT website and stuff. And right when you brought it up, it was such a visual. So basically they had a tooth with a mercury amalgam and then an eraser. And it went like that. And you can just see the gas and come off. So it represented just chewing and what that would do. But that, to me, when you saw that as an individual, it was like, whoa, that's for real. You know?
Right.
Yeah.
Right. So some of the associated, like symptoms of that are, like brain fog, ringing of the ears, neurological issues. And so we've had some pretty cool results with patients who had like chronic ringing of the ears or trembling or, other things that have resolved when we removed mercury. So it's a real passion.
So, we get patients coming in who are, once they hit us, they want to do everything to clean up their bodies and detox. And a lot of times their guts aren't balanced, their hormones aren't balanced yet, particularly their adrenals. And we prefer to stabilize them in that way first before undergoing something like this. So do you agree with that?
That's a huge part of our practice for sure, is collaboration with functional providers. So that's why like I said, we always encourage a functional evaluation to determine those things so that the body is best able to deal with the stress of that and to detox after it's complete.
Yes. So that was just one thing I wanted to highlight with our audience, because yes, we may agree with that, but we want your body to be prepared to be able to detox, because what is it that could happen if the gut isn't, there's some leaky gut inflammation going on, the adrenals can't handle it, and all the brain fog. Could you explain what potentially could happen if we did take those mercury fillings out too early?
You probably have better awareness of that systemic response, but I would guess that the patient could go under some type of toxic overload or like sickness, right?
I mean, that's what we're trying to prevent anyway. We just want to do it in the safest way possible. Now, you prep your client, your patients, right? I mean, so say that they're ready to do that. They got the okay from the functional practitioner. And then is there a prep period that you have before you actually do the procedure? Is the procedure done in different steps?
The procedure is done, typically in quadrants. So like upper right, upper left. And it kind of all depends. Like in our practice, there are times definitely like a patient will present with a broken tooth, and so it might have mercury in it. And so there's not really a lot of systemic absorption that occurs because of the way that we're doing it. Really when we chunk it out, like the mercury comes out in a whole piece usually. So in an ideal situation, the patient's either coming to us from practitioners like you with the request of detoxing. And, so typically what that looks like is I do an initial exam and then I would communicate with the practitioner. These are my findings. This is, they have this many mercury fillings and this is what our recommended treatment is. And then they collaborate back and forth between the two of us. But sometimes it is a situation where they come in with a tooth that has a mercury filling and we have to, move forward with treatment. And so we take all the precautions that are necessary and then recommend they follow up with a practitioner. So, and everybody's a little different. Some practitioners will recommend, that they have a set protocol for every patient that they do 3 days before and 3 days after. Some practitioners have a 2-week protocol that they do 2 weeks before and 2 weeks after. Some functional providers, are like, I don't need to test for heavy metals. I don't need to do anything. You get the metals out and then we'll detox after. It's a little different for each individual and each different provider.
Do you have a preference on testing for the heavy metals?
Not really. I mean, there's the hair test or urine test, right? I think the urine, in my opinion, probably is a little more accurate.
Okay, cool. Yeah.
Okay, awesome. Are there any other holistic therapies that you use? You do some homeopathy, right? Are there any other holistic modalities that you incorporate into your practice?
Yeah, one of the big ones is ozone. So we use ozone therapy in all of our treatments. So ozone, for anybody who's not aware, is oxygen. So it's basically 3 molecules of oxygen, and oxygen's happy and stable at pairs of 2. So ozone is just great at that. That third molecule kind of goes in there and binds with bacteria, viruses, fungi, protozoans, like all the things. It's a great like natural disinfectant, and it also helps to desensitize the tooth. So when you've had a tooth with a cavity, we use it. So we have a dental handpiece that kind of has a little tip on it, and we infiltrate the tooth with ozone gas. If patients have root canals that they want to keep for some period, we do ozone injections, typically like 5 to 7 injections a week apart to kind of disinfect the area. We use it in our periodontal treatments, like when patients have gum disease. We use a perio handpiece to infiltrate ozone. So ozone's a big part of our practice. And it's just really like I'm learning more and more about the use of that just in medicine in general. So I had a patient yesterday who was telling me she was a collegiate basketball player, and I was kind of asking her how she got into holistic health. And she said at 18, she had a knee injury and she received a cortisone shot, which damaged the cartilage in her knee. And she was told at 19 she was going to have a knee replacement, and her mom said no. So they found someone in Atlanta that did a TENS pass with ozone for her and completely regenerated her knee. And she's, functional and never had to have that. So just cool stories with regards to ozone, just in medicine in general. But we use a lot of ozone. I'm really passionate about that. We have a laser. So we use a laser therapy in some of our periodontal therapies as well. And then just as we do some of our treatments. And then, yeah, like homeopathy is definitely something we offer. So we have a couple of homeopathy modalities, like, x-rays are a necessary part of dentistry, but we have some options if you want to try to mitigate those effects. And a lot of times, honestly, like my patients, like I have patients that have extensive knowledge in homeopathy, like probably more than I do even, but they bring those things to the table. So if they have a particular issue, but there definitely are some homeopathic remedies for toothaches or canker sores or various things that people deal with.
So what I'm hearing a lot, I mean, obviously we hear about fluoride, and I've always learned through like kind of how did fluoride make it into toothpaste and dental products a lot of times. And it was just because one industry was kind of polluting some areas and they want to find a place to put it was part of the story. Now, I do also understand that a lot of times when you have issues of like gum disease, maybe from oncology treatments, that fluoride actually can serve a good purpose and benefit. But for the broad base of stuff, I'm kind of curious on your take on it. Is it needed, and are there alternatives?
There definitely are alternatives at this point. And so we don't use any fluoride. Fluoride definitely has documented benefits to reducing the susceptibility of the teeth to cavities. It can, help to protect the teeth from acid breakdown, but it also is a neurotoxin, and studies, I'm sure you guys are familiar with, but to show, that it lowers the IQ, it builds up into certain organ systems. And so again, kind of going back to that focus on diet and nutrition and treating root cause. So that's what we try to focus on. But there are hydroxyapatite is kind of a newer modality that is a naturally occurring mineral. That's what the teeth are actually made of. A lot of toothpaste and products now are utilizing hydroxyapatite, which has shown success in studies to remineralize and strengthen the teeth too. So that's our focus. That's what we prefer. And there's great, like our, part of our practice philosophy, which we haven't kind of talked about yet, is the option of the opportunity to reverse some cavities. So if you come to me and you have x-rays or we diagnose a cavity and it's limited to just the enamel, we recommend and encourage a protocol to try to reverse that. And hydroxyapatite is a big part of that. So trying the option of reversing that. So we're fluoride free. A lot of people don't understand too that, if you do prefer no fluoride and are refusing your traditional fluoride treatments in practice, like a lot of the materials used in traditional dentistry still release fluoride for some time. So if you have a traditional composite placed, which is a tooth colored filling, or a crown cemented with traditional cement, then it's going to release fluoride for up to, sometimes up to a year. So we've chosen and selected materials in our practice that don't do that.
Very cool. Very cool. Hydroxyapatite, it's always been a form of calcium that has higher absorption. And so it's kind of cool to see how it's used orally as calcium, but also in the toothpaste, because I've been hearing a lot more of that lately too in toothpaste as the alternative. So awesome.
Yeah.
Cool.
So if you have patients who have had these procedures and they may be off-gassing or potentially toxic, would you recommend even just, some kind of low grade detox, like a liver detox or something, or chlorella or something like that?
Cilantro.
Yeah, I mean, honestly, that's where I'm referring people to you guys or to other, to functional practitioners. So my ability to assess what's in the mouth and to identify toxicities and to choose biocompatible materials. But my preference is to work with you guys who have a more extensive knowledge systemically of what they need as far as those protocols. So, so we definitely are recommending those, but I like to do that in collaboration with a functional provider.
So we do have a place on our intake form. We do ask if they have amalgams. Is there anything else as far as a dental history that we need to be probably more aware? Because I see it.
Yeah.
I'm not saying that I zoom in on it all the time because there's other things, but this is really enlightening me to, pay attention to these kinds of things that may be subtle or not so subtle, or contributing maybe even to some of their symptoms more than I think they are, because we know that the environment can be toxic, but if it's in the mouth and exposing the tissues, the brain, the guts, on a daily, constant basis, then that's something that I would want to really highlight or focus in on. So could you give me, what would you want? I know this is probably in your intake form, or something that I, as a screen, to maybe send them to you for something to look closer into.
Mercury's a huge deal. So do you have any silver fillings? Do you have any metal in your mouth? Do you have any root canals? Have you had a long-standing history of repetitive cavities? Those types of things. So when I see that, then typically my follow-up email to a provider like yourself would be, I saw patient A today as a new patient. These are my findings. She has, and I'll actually list by tooth. She has mercury fillings here, here, and here, and then existing root canals in these particular teeth, which are on these particular meridians, which is a whole nother subject to discuss. But with regards to, these are the organs that are associated, because a lot of practitioners working with aren't as expanded as you guys. So these are the meridians, these are the associated organs on those meridians. And then we collaborate, because a lot of times, I'll just be honest, we're seeing a lot of toxic things in people's mouths. So when you look at mercury fillings, multiple root canals, sometimes a metal retainer, and the patient's coming to me they're sick, they have health issues. So sometimes they can start and be ready and detox everything, but a lot of times it's a financial decision on where we focus. And it's also from your healthcare perspective, your healthcare provider's perspective, what takes priority? What are you dealing with? What are your inflammation levels? Have you had a thermography scan? And if so, what area of your head and neck are showing most inflammation? And so as we look at what are my goals as my practice continues to expand and looking toward the future of holistic functional dentistry, is just more collaboration intimately with providers, a network of providers to address all of those things. So that's kind of how I like to do it. But yeah, mercury, root canals, metals, frequent cavities, mouth breathing, all of those things. So those are the things that I think, definitely are like intimately connected to both areas.
It brings me back to my days of kinesiology and muscle testing, because that was actually part of it, is actually seeing where they reflected to. And I think it was the Germans that mapped that whole thing out years ago. And it also brings insight on how the mouth, you're talking about the mouth, you're talking about the teeth, but really how directed and how related it is to our complete systemic health. And, you can have mystery illnesses that can be discovered through the mouth, right? I mean, anything from low-grade infections to inflammation. So it's all fascinating. Thank you.
And also cavitation. So that's an area that I didn't mention, but cavitations are a very big area in holistic dentistry. But basically where you've had teeth removed, if the bone didn't fully form back in, then you can have necrotizing areas. I don't know, maybe, are you guys familiar with what they are? You can have necrotizing areas of dead bone, basically, that can harbor bacteria. So holistically, that's always something that we evaluate as well. Like, did you have wisdom teeth removed? We always, suggest a cone beam evaluation, which is a 3D X-ray to evaluate if so. And so if people are dealing with just, health issues they can't get to the bottom of, a lot of times they're having those, that's being diagnosed and evaluated as well. So cavitations are an issue as well. So yeah, but the meridian thing is really cool in regards to, energetically how things in the mouth, and then also just issues with the reciprocal organ systems can impact the mouth as well. So really cool stuff. Talking about energy testing, something I'm super excited about adding into our practice. I haven't had anybody around here that offers that, but we do offer biocompatibility testing. So as you're talking about, like, you're with your patients, as you're going through their, their new patient thing, so there is a company called DNA Connections and Biocomps Labs that does a blood test. So we can actually give you the blood test, take it to the lab. You have a blood draw, and then I get a report back that has basically every brand of dental material. So like every brand of porcelain, every brand of composite, every brand of cements for the most part. And it lists for that particular patient whether they are low, least reactive, moderately reactive, or highly reactive. The challenge with that is I would love to be able to couple that with energy or muscle testing to be able to support that. And I know a lot of practices that I'm in study group with, they are starting to integrate that with energy testing too. So that's a goal of mine to add that in as well. And so we offer that to patients. Luckily, we're using what's kind of established as the most biocompatible for the majority of people. But for people who are dealing with health issues or more sensitive, or we encourage it for everybody. If you want to do that, for every patient, and that is an option that you can do to get really specific about the types of products that we use as far as materials.
This is a whole another world. I'm so fascinated by it. Well, I think, and you talked about the collaboration thing. I just think it's just what you're saying, this education, because it's one thing to go she doesn't use, fluoride in her toothpaste, and she makes my teeth look pretty from a natural, but this is a whole nother level of what you're saying, connecting the mouth as a reflection even too of the health of the body, right? So I think it's equally important. Is any of this taught in dental schools, or?
I mean, it's taking pieces of it. So it's so separated though, but yeah, we do learn. I mean, in dental school, we take, microbiology and all the things with the med students. So we learn from that perspective, all of the pathology and for whole body. It's just so separated, and that becomes this practice of just drill and fill and addressing problems versus, and I don't really know why. I don't know if it's just a time thing or, but yeah, it kind of becomes separated in a different practice shift and modality. But we do learn, not from a holistic perspective, but just definitely the basis of the, microbiology and physiology and all that. We learn that in school, but not to that level. And nutrition wise, definitely not the focus.
It's always lacking in our education, for sure. So what advice would you give dental professionals who were interested in transitioning maybe to something like what you're doing, more holistic practice model?
It's very overwhelming. I mean, there's so much to incorporate. It's been a definite journey for me. It has to be a personal passion, to be honest. I mean, the practitioners that I collaborate with mostly and am in study groups with, like, we've all had some type of personal health journey. It has to become like a personal passion. So, but really just becoming a member of the IOMT, the IBDM, those are great resources. Taking a class on ozone. But again, like a lot of my education and passion like was just driven by like my family's journey, my own personal journey. Like it just kind of like one thing kind of led to another. When I think back on it, it's just kind of like, this evolving thing that honestly was just kind of like through struggle, but I'm so thankful for it. I think trust is a big thing too. So like being able to create an environment, like there's so much trauma and negativity and anxiety associated with dentistry. So like for me, part of my personal, my personal interest in dentistry to begin with was driven by the fact that like a lot of my family members were dentists. So it was never something like I was afraid of because there was an element of trust there. And so it's really important to me to establish a place that people feel comfortable, like coming from that, like that element. Like there's a lot of shame associated with neglect, or like I see a lot of moms who haven't been for 5 or 6 years, and there's a lot of shame. So we really try to create an environment where you can come and we can move forward, and we can give you an environment where you feel comfortable and trust us and actually encourage health, if that makes sense.
Well, your office is beautiful. It's like walking into a spa. It's super bougie. I love it. I do love it. So you're welcome. You've done such a great job. So Dr. Warren, where can our listeners learn more about your work and connect with you, come see you in the office, follow you?
Yeah, so our website is drvaleriewarren.com, just like drvaleriewarren.com. There's a lot of information there. Instagram is at, again, Dr. Valerie Warren with just DR. And then we have a Facebook page, which is Valerie Warren Dentistry. Those are probably the best places to find us.
Okay, awesome. Thank you so much for my mind is blown. I love this, and how we can also, when we're teaching our practitioners, to really not neglect this area of the face, of the body, right, because it's so there's just a lot of wisdom in there that we can gather, and it's a big part of health and well-being. So thank you so much.
Thank you for listening to this episode of the Soul of Medicine podcast, where science meets soul for whole health healing. Are you ready to reclaim your energy, vitality, and soul purpose? Then feel free to head to our website at kcorpusmd.com and schedule an appointment for your root cause review.